afternoon, everyone. Thank you all for coming. How exciting is this? My name is Juliette Muka. I'm the director of the St. Amant Foundation. Welcome to the Winnipeg Foundation, representatives from organizations who do amazing work in our community, and all the people we support, our families, our staff, our volunteers and donors who are dedicated to supporting St. Amant. Today we are so pleased to announce the generous funding from the Winnipeg Foundation, $950,000. We are so optimistic about the future for children and adults with developmental disabilities. This grant will help us continue to build on our partnerships with other community agencies to better serve people with disabilities. We know we're on the brink of major service and policy changes to support full inclusion and a community shift in the value we place on people with disabilities. For those who don't know, this is not the first time the Winnipeg Foundation has invested in St. Amant. And in fact, they have supported St. Amant in a very significant way for many years. The St. Amant Research Center was able to get off the ground because the Winnipeg Foundation saw the potential and the benefit to the future of people with disabilities by investing in research. Their support led the St. Amant Research Center's further $8 million in research grants in the areas of autism, choice, challenging behaviors, healthcare, special research projects to meet the knowledge needs of our caregivers. The St. Amant Research Center continues today, and in fact, we've added another researcher. That initial investment has made a great impact in our community already. Most recently, the Winnipeg Foundation funded the new St. Amant Leisure Guide, which includes various sports and recreation activities throughout the city, including the Friday Night FM Cafe, formerly known as the Funky Monkey, which is a social gathering with live music for people with disabilities to have fun and create some new friendships. Registration for all the Leisure Guide activities has sold out in record time, and so well received that the Leisure Guide is now a regular part of our St. Amant Foundation funding priorities. By renewing your commitment to St. Amant with this nearly $1 million grant and funding these 3 initiatives over the next 5 years, you are changing health and social policy to significantly improve the support available to children and adults with developmental disabilities, autism, acquired brain injury, and fetal alcohol syndrome. I'd like to show you a video that explains these 3 initiatives and this grant will support.
We are so grateful to the Winnipeg Foundation for the $950,000 grant that is going to allow us to support 3 major initiatives here at St. Amant. The St. Amant Research Center will support the planning and evaluation of 3 transformative projects here at St. Amant. The first is the transition of 75 people from River Road to the community. The second is the creation of a continuum of respite services. And the last will allow us to evaluate the creation of our new crisis stabilization services.
The research literature and the professional literature dealing with developmental disabilities can't tell us all that much about the best way to do these things. You know, we'll be looking at how the changes affect, first of all, outcomes for St. Amant's clients, for the families that we serve, but also for the organization. What does it mean for the individuals? What does it mean for their families? What does it mean for the service professionals who are maybe having to learn how to deliver service in a new way or in a new context? What we learn has the potential to be really transformative. It could inform policy, for example, around the funding and provision of services to individuals in Manitoba for years to come. So it's a great opportunity.
It's been really important to have a respite program at St. Amant because it allows families to have periods of rest, and it usually benefits especially the families that have the more medically complex individuals. And I think ultimately it has saved many of the family dynamics of many clients we serve.
We learned through our worker, she told us about it. and St. Amant is a name that's familiar to most people in the city.
I think that the importance of providing respite for people just to be able to recharge their batteries and continue on with the responsibilities is I think it's difficult to place a value on that.
Crisis Stabilization is a community-based service that we hope to partner with over 50 agencies on. I believe that St. Amant is in the best position to provide crisis stabilization services for those in Winnipeg and beyond, based on two reasons. The first is expertise. We have a long history of working with clients with challenging behaviors and a really great success record. The second reason that we're suited to provide this service is based on our resources. We have a variety of clinical resources that range from physiotherapy, occupational therapy, and to significant and intensive psychology services that help us best provide service to those that are struggling with behavioral challenges.
The second initiative will improve access to healthcare for people with developmental disabilities by creating a community clinic. And in addition, in partnership with the University of Manitoba, we'll be able to train new doctors coming to work in the community, as well as enhancing the educational opportunities for physicians who are already part of the community.
The healthcare system wasn't really set up to manage people with intellectual disabilities, people that are nonverbal, and be able to assess them properly. It does take some skills to do that, and those are teachable skills. So I think overall we know that as people are in the community that there are certain types of health problems that often are challenges. Even just simply as going to a family doctor or a walk-in clinic office, but having to wait in a busy office for an hour to spend 5 minutes with a physician and probably require more time than that. These are all things that a different type of model where we can go out to the community or provide more outreach and support is going to make us a stronger healthcare community, but also really benefit the disabilities community.
I think in the long term what this does is it helps train physicians that have the tools and the skill and the knowledge to care for these patients in their practices. And when we look at how we better support patients within the community, we need to ensure that all our providers have that skill set. I think what we will get through this initiative are the tools that ensure that patients really get comprehensive preventative care that's tailored to their specific needs. This is a really innovative project. It helps us as a university interact with our community partners and ultimately make a difference in the care we provide patients.
We're changing healthcare for people with disabilities in a way that's going to be not measured in a year or 2 years, but it's going to be measured in a decade or 2 decades. These are the changes that need to happen in healthcare, and we're making it happen at St. Amant. So this is exciting to be part of it.
Our third project is to renovate one of our living units here at River Road to bring it more up to the standard of other healthcare facilities and long-term care facilities.
The benefits of having a single room is you get much less spread of infectious diseases, you get much less spread of simple colds. So just a healthier population, and with a healthier population they can have more active lifestyle. Much nicer to be able to have care provided to you in a private setting versus in a shared setting.
And for us it allows us some quiet time where you're not being interrupted, you're not intruding on people and they're not intruding on you while you're visiting. And Angela has a room to herself, which is now about twice the size of the old room she had. So she's got all the room for all of her equipment. It's private. We can bring in all the pictures we want, the wall hangings we want, drapes for her windows, that type of thing. So it was quite a move. So with that, I'm just saying that it would be a real blessing to see everybody in that situation.
The work that we're going to be involved in will create a fundamental shift in how services will be delivered in the future. Historically, much of our expertise has existed in an institutional model, and what we're hoping to do through this initiative is share that expertise and to strengthen the continuum of services that are available within the community. We are extremely grateful to the Winnipeg Foundation for seeing the value of people with developmental disabilities and for giving us this grant to accomplish what we see as absolutely mission critical work for our organization and the larger community. So thank you very much to the Winnipeg Foundation.
I'd like to invite John Leggett now, President and CEO of Saint Amant, to talk about these projects and the overall impact of this funding to our community.
Thank you, and welcome to everyone. I want to start by welcoming Rick and Jennifer from the Winnipeg Foundation, my colleagues from other agencies around the province, our partners at the University of Manitoba, and all of you. Thank you for being here today to hear about this generous funding announcement, our 3 projects, and all of the people who will benefit over the next 5 years and beyond. As you saw in the video, these projects are going to change the landscape for people with developmental disabilities. That includes people with acquired brain injury and those being diagnosed with fetal alcohol syndrome and effects. We've come a long way in the last 50 years in the way we support people with developmental disabilities, in the respect and inclusion we show as a society, and in supporting and advocating for human rights. As a society, it's clear that we want to treat people equally. We want to help people who need help, and we want every individual to be treated with dignity and respect. But as a society, we don't always know how to do that or how to fund that. That's where the Winnipeg Foundation is truly a community treasure. As Juliette said, this is not the first time the Winnipeg Foundation has believed in Saint Amant, funding worthy research and new projects to promote independence and inclusion for people with disabilities. Individually, each of these projects is great. Renovating space and ensuring people have a dignified place to live is very important. Opening a clinic to increase healthcare capacity is important and needed in our community. And anytime research can directly support the implementation of change and be used to help others is fantastic. However, collectively, what these projects mean to our community is much bigger, more significant, and really so exciting. Through our strategic plan, we've moved 15 people per year to live in the community. We're in the process of changing from a developmental center to a healthcare center, effectively leaving only one institution in Canada. We know that moving people to community works because we've been doing it for over 30 years. What we don't have is hard and fast data on what plans need to be in place to make for a successful transition and how we know that someone is happy in the community. We have circumstantial information, but no one has ever taken the time to evaluate a person's quality of life before, during, and after a transition. This research project will do that. Through our strategic planning process, we've surveyed and interviewed over 700 people in Manitoba. We asked them what's needed to improve the lives of people with developmental disabilities. Overwhelmingly, we heard that families want more respite options, more resources for families in crisis, and the number one need was better access to medical practitioners who have experience and understand how to care for a person with a disability. Specifically, people with complex health needs who have limited ability to communicate. By developing a community healthcare clinic, we're not only filling a gap that we know is a desperate need, we have the opportunity to bring all of the world-class knowledge and expertise from within these walls to the wider community. Saint Amant's community program has always had the benefit of being linked to the professionals located here, but other agencies rely on community medical and clinical professionals. This project will accomplish a few things. First, more people with developmental disabilities will have access to a specialized group of medical and clinical supports. Second, with the partnership that we have with the University of Manitoba, we are training future healthcare providers to understand and experience working with people with disabilities. As these professionals graduate, they will take this knowledge into their new practice, increasing our community's overall capacity to deliver quality medical care, which is a basic human need and a human right. As people transition from living in this building to living in the community, and as the space changes from a developmental center to a healthcare center, our services will change. We'll be supporting people with very complex medical needs, some of those whom live here right now. We'll also be supporting people in crisis who have very complex behavioral needs, and we'll be providing more respite and more respite options to families who are supporting a person with a disability in their home. Through this project, St. Amant Research Center will also help us plan and evaluate our new respite and crisis stabilization services. As you can imagine, if these services are to be successful, they should help ensure that individuals are able to live in their community home longer, and it will also ensure that individuals either return to their home after a crisis or transition into a new home that can accommodate their needs. Providing good quality respite and crisis stabilization services will relieve a burden from emergency rooms and emergency placements within the Community Disability Services Program. The Winnipeg Foundation, with one very large grant, is successfully changing the landscape of service delivery for people with developmental disabilities in this city and beyond. This means that not only people supported by St. Amant benefit, but the wider disability community benefits as well. It's about time that St. Amant takes its expertise on the road to share our knowledge with others. Ultimately, this funding is changing the way we deliver services now and in the long term. Thank you to the Winnipeg Foundation and all of its donors and supporters for their vision and commitment to the future of our city. Thanks very much.
Thanks, John. As John referred to in the video, the living area renovation will be the catalyst to launch the fundraising efforts needed to complete an overhaul of the 5 remaining living units here at 440 River Road. I'd now like to call on Mr. Rick Lucier, Senior Grants Associate from the Winnipeg Foundation, to bring greetings.
Thanks, Juliette. John, this is a pretty exciting day, pretty exciting time for St. Amant, and we're very pleased to be part of it and be able to share that. I'm here with my colleague Jen Partridge, and we're thrilled to be able to share in the day. The Winnipeg Foundation is proud of its long partnership with St. Amant. We've made our first grant in around 1972, and over the past 40-plus years, we've made grants to a lot of different areas, including occupational therapy, furniture, an integrated daycare, family-based care program. We are a major supporter of their research center that's so prominent in Western Canada, computers, and more. These grants have been made possible thanks to donors from all walks of life who have supported our foundation over the past 95 years, and this year is our 95th birthday. Some of our early donors wouldn't have heard the term autism or envisioned the care now available to individuals with developmental disabilities. Nevertheless, their dreams for our community and their trust in our foundation means their gifts supported St. Amant through the years. Of course, many of our donors are passionate about the quality of care in our community. Funds established over the years by Martha Donovan, Marion and Gordon Douglas, Luella Ada Beese, and Samuel Gilfix have all provided additional support to St. Amant. And many donors today support the organization through their funds at the foundation, including our young people in our Youth and Philanthropy program. Last year, the St. John's Ravenscourt Committee of Youth made a grant toward prescription eyeglasses, hearing aids, and speech devices for individuals served by St. Amant. Clearly, St. Amant's work touches many by providing direct services that help individuals and their families, informing our healthcare system with new research, or creating the kind of community we all want to live in, one where care and compassion is paramount. This year, we mark our 95th anniversary of the foundation, and we're recognizing that milestone with a grant of $950,000 to St. Amant. This is one of the largest grants made possible by generations of donors to whom we owe our thanks. We're also thankful to the dedicated staff of community organizations such as St. Amant, who bring to life the Winnipeg Foundation's vision of a Winnipeg where community life flourishes for all. We wish you well in the next phase of your growth and development, and thank you for including us here today. Thank you.
Thanks, Rick. The success of this project does not lie with Saint Amant alone. The partnerships we're building with the University of Manitoba and our colleagues at other disability agencies in our city and province are integral to the overall success of these projects. I would like to extend a sincere thank you to Dr. José François from the University of Manitoba, Faculty of Medicine, and all of our partners through Abilities Manitoba who have generously provided input and support to this grant and who will be involved in helping us shape the projects and the outcomes. Again, I would like to express our overwhelmingly gratitude to the Winnipeg Foundation as they celebrate their incredible 95 years of community support. Your vision and your generosity mean the world to over 10,000 children and adults with disabilities in our province and their families. So this brings our formal announcement to an end. We have many people here who were featured in the video that are available for some questions. Thank you everybody for coming. Help yourself to a cup of coffee, and thank you for coming today, and thank you for those who are tuning in online. Have a great day. Merci.